In January 2020, the Interagency Task Force on Emerging Infectious Diseases was convened by the Philippine government to address and prepare for the emerging and fast spreading of COVID-19 virus. The purpose of the National Task Force is to manage the spread and mitigate the impact of the virus on the Philippines' citizenry and economy. As a result, the IATF has conceptualized an action plan on how to control this infectious disease. Regional IATFs were also activated to address peculiarities between different areas in the country and to decentralize the implementation of COVID-19 mitigation programs in line with the policies set forth by the National IATF EID. In Central Visayas, the Regional Joint Task Force 7 Central Visayas Shield was initiated, which was composed of Police Regional Office 7, Philippine Coast Guard, Bureau of Fire Protection, Task Group Cebu, Bohol, and Siquijor, and Philippine Army to serve as the law and order cluster of the Central Visayas IATF EID. In preparation for the possible escalation of COVID-19 cases in Central Visayas, PRO7 leadership initiated the creation of a Crisis Response Battalion on March 18, 2020, staged at Cebu City Sports Complex. To systematize the handling and management of areas with COVID-19 confirmed cases, protocols in securing containment zone were formulated. These protocols were cascaded to the different site task groups for guidance and implementation. Daily COVID-19 response update meetings. The regional director, together with his command group, regional staff, special staff, provincial and city directors, and other concerned regional chiefs of the national support units, have been holding daily meetings where updates and initiatives in COVID-19 response are reported and discussed. Due to this initiative, the efforts of all units are aligned and unified that was contributory to the improvement in the infection status of Metro Cebu and other parts of the region. As early as February 12, 2020, upon the directive of Police Brigadier General Albert Ignatius Ferro, Regional Director of PRO7, established its monitoring center for COVID-19. The center is already fully operational and is performing its functions of integrating efforts in contact tracing across the region and monitoring developments. Director monitors the efforts of contact tracing teams, including backlogs from daily confirmed cases. The results of monitoring allow immediate intervention and effectively preventing build-up of backlogs. From July 12, 2020 to present, a total of 664 persons from 5 different police units, cities, municipalities who were trained by the PRO7 Regional Intelligence Division Contact Tracing Training staff with the Baguio City Contact Training methodology. The following are updates to the initiatives implemented relative to PRO7's contact tracing efforts. Cebu City's contact tracing strategy, incorporating best practices from Baguio City, effectively boosted Cebu City's campaign against COVID-19 health crisis management. Cebu City has been divided into 5 clusters: the North, South, Central, East, and West clusters. These clusters will serve as the different clinic cluster of Cebu City. It will operate as a triage consultation clinic so that private and public hospitals will not be overwhelmed. In retrospect, these 5 clusters will function as the contact area of our police and health worker contact tracers, considering that there are 80 barangays in the city. All reports will be processed by the Contact Tracing Operations Center stationed at Cebu City Hall. Reports will be the basis on the implementation of granular lockdown, depending on the intensity or number of COVID-19 cases on a particular cluster area. The aggressive contact tracing efforts of Police Regional Office 7 is a game changer to defeat COVID-19. DILG Undersecretary and spokesperson Jonathan Malaya said that the success in Cebu City can be attributed to the creation of cluster clinics, barangay isolation center, quarantine facilities, deployment of tracing teams, and widespread testing. Hence, the biggest game changer is the aggressive contact tracing, from 5 teams now to 130 teams, implementing Mayor Benjamin Magalong's formula of tracing 37 contacts per COVID patient. By doing so, infected individuals were isolated to cut the transmission before it infects the community, which was done in the region. At present, a downtrend and cases are now manageable. 96 graduated from the Baguio City Contact Tracing Methodology Seminar on July 8, 2020, who was trained to improve the contact tracing system and curb the virus transmission. Accordingly, the system's conceptual framework involves identification or detection of the source and possible sources of infection, isolation of these persons, testing and tracing of the close and remote contacts for quarantine, testing, disinfection, and medical protocols. It uses cognitive interviewing skill, a police questioning method, to establish the links of a patient. The system also involves convincing patients to disclose their identities to help in contact tracing, which is also crucial as full disclosure can help alert contacts and cut down tracing time and resources. Johns Hopkins University Online Contact Tracing Course. On August 6, 2020, the Police Regional Office 7 started enrolling for Johns Hopkins Online Contact Tracing Course. As of August 27, 2020, we now have 9,340 graduates recorded. PRO7 is taking advantage of the course while the waive fee program is in effect that allows students to enroll without the $49 fee, courtesy of Bloomberg Philanthropies. PNP personnel who tested positive for COVID-19 are closely monitored by the Regional Health Service 7, from the moment of admission to the facilities up to their discharge from the recovery center. Total health care is given to them to include mental health care aspect. Telecounseling sessions done by personnel in the neuropsychiatric section of the Regional Health Service 7 are given to them, and follow-ups as may be necessary to strengthen their mental and psychological wellness, facilitate coping mechanisms, and provide social support during the crisis. Before discharge, psychological evaluation and accomplishment of psychosocial support forms to PNP personnel who have recovered from COVID-19 is again conducted to minimize, if not prevent, the development of anxiety and depression, ensure that they are physically, emotionally, and mentally fit to go back to duty, and in the process, facilitate in their reintegration back to duty in the community where they served. The construction of the molecular laboratory at the Police Regional Office 7 is nearing completion. The facility will serve as a coronavirus disease testing center for law enforcers and other frontliners in the region and will be operational next month. The laboratory and swab booths are 100% ready to include the billeting area for medical technologists. It is Level 1 approved by the Department of Health and has negative air pressure already. Once the construction is completed, PRO7 will have its accreditation from the Department of Health for it to become fully operational. The laboratory will operate under PRO7 Regional Health Service 7. As part of the PRO7 I-5 strategy, which is to inform, identify, isolate, intervene, and integrate was crafted in the support to the government's Test, Trace, and Treat strategy, or T3. With a low number of new coronavirus disease cases recorded in the last 2 weeks, the Department of Health Central Visayas believes Cebu City is now en route towards flattening the curve.
I would say, now we have flattened our curve here in Cebu City.
From August 1 to 19, 2020, the Department of Health 7 recorded a daily average of 23 new coronavirus cases in Cebu City. Additionally, checkpoints, quarantine and border control points, and deployment of augmented force coming from the Special Action Force and police personnel from Regions 6 and 8, who were assigned to augment Cebu City policemen in implementing the minimum health standards, proved to help lessen the region's crime rate, with reportedly recording only 12 crimes in a day. PRO7 Regional Director Police Brigadier General Albert Ignatius Ferro said, "The success in containing the virus in Cebu is because of continued police vigilance. Moreover, the cooperation between local officials down to the barangay level and private individuals are the contributing factor in Cebu City's success in flattening the curve." The Cebuano community taught themselves to follow health protocols and guidelines, bringing the coronavirus disease 2019 outbreak in Cebu to manageable levels. Drone patrol. Following a rise of coronavirus cases in Central Visayas, 11 drones are now in Cebu City to monitor the compliance of residents to quarantine rules. The 11 drones are being piloted by Cebu City Police Office to monitor quarantine compliance and to shoot videos of areas where weak points and potential areas of quarantine violations would occur. The purpose of drone deployment is that if ECQ violations are observed in a particular area, troops will be immediately sent there to enforce the quarantine rules. PRO7 various response and security deployment during this pandemic, like securing quarantine areas, contact tracing efforts, community support, and interagency collaboration, assist the repatriation of foreign nationals, seafarers, overseas Filipino workers, and locally stranded individuals. PRO7 vowed to improve its healthcare support system for police officers, health personnel, and others who are at higher risk of exposure to the coronavirus disease. Health protocols had been strictly followed by the PRO7 personnel, especially that Cebu City had become one of the hotspots of the virus in the country. Following the protocol had helped PRO7 stand firm with more personnel despite the rising cases in the city and some personnel testing positive. The alertness of the Regional Health Service Unit in terms of closely monitoring all the personnel's health is also one of the reasons the recovery cases had been progressing. Through effective contact tracing, infection transmission can be stemmed, and the public may avoid reverting to enhanced community quarantine or unnecessarily prolonging transition to general community quarantine. Creation of Macatao Malasakit Recovery Center. PRO7 Macatao Malasakit Recovery Center is located in the City Resources Management and Development Center or CREMDEC building in Barangay Taptap, Cebu City, formally opened on May 29, 2020. The CREMDEC building will be utilized as PRO7 for COVID-19 patients. The recovery center can accommodate between 30 to 47 personnel who are COVID positive. Likewise, the recovery center is medically equipped and ensures health recovery of policemen. The recovery center is designed to aid the welfare and wellness of PRO7 frontliners. Also, the recovery facility will further have sports equipment and wellness centers so officers can remain physically fit. PRO7 is one with the nation in its fight against COVID pandemic, and we will heal as one. Reintegration COVID-19 graduation. True to the oath, the PRO7 frontliners back at the front lines after recovery. The coronavirus disease 2019 health crisis is teaching us the urgency to embrace primary care. Police officers from Police Regional Office 7 have recovered from the coronavirus disease and are ready to go back to work after overcoming the deadly disease. These cops will now be reintegrated to their posts for their usual duties as police officers. Out of the 539 personnel who were infected with COVID-19, 500 have already recovered, which means 90% recovery rate, the highest recovery rate in the country. These police officers have already been tested negative for the virus and have completed the needed requirements to ensure that they are fit to get back to work. After 14 days in isolation, these COVID-19 police officer survivors were subjected to RT-PCR swab testing. Once testing negative of the virus, these police officers were also made to undergo counseling to prepare them for the reintegration. PRO7 remains optimistic in high recovery rate of COVID-19 cases among police frontliners in Region 7. Although confirmed cases remain under strict monitoring and medical observation, PRO7 is taking the necessary steps to fast-track mass testing among police frontliners and follow strict quarantine protocols, as well as disinfection and decontamination safety standards in our facilities. The disinfection program is meant to prevent the resurgence of the deadly coronavirus disease. PRO7 Makatao Malasakit Plasma Donor Program. As COVID-19 continues to be a public health problem, the Police Regional Office 7, together with the Regional Health Service 7, fostered PRO7 Makatao Malasakit Plasma Donor Program in collaboration with the Department of Health, Department of Social Welfare and Development, Office of the Presidential Assistant for the Visayas, in response to the call to donate blood and save lives. A total of 164 COVID-19 recovered PNP personnel volunteered to donate their plasma to support the efforts of DOH in treating other patients. Accordingly, the first plasma transplant in the Philippines was in Cebu, wherein 2 Cebuanos benefited from the plasma donor program. The donors were police officers who have recovered from COVID-19 and participated in the regular conduct of PRO7 Makatao Malasakit Plasma Donor Program. Police Brigadier General Albert Ignatius Ferro, Regional Director, PRO7, said that the gesture of donating blood is a selfless act in saving other people's lives. The feat in overcoming COVID-19 will help save those who are badly hit by the deadly disease. Individuals who have recovered from their infection could save the lives of those who remain sick of COVID-19 by making a donation of their convalescent plasma. According to the World Health Organization, the use of hybrid therapeutic plasma exchange and convalescent plasma therapy, which involves the removal of the bad plasma and replacing it with good plasma from donors, is currently being considered as a treatment to COVID-19. The bad plasma of survivors is believed to contain antigens and antibodies that are needed to fight the rather new virus. Truly, this is concrete proof that police officers save lives not only in crime prevention, crime busting, peacekeeping, as well as with health programs of the government in fighting against COVID-19. Amid the COVID-19, PRO7 has constantly embraced the legacy of valor, service, and sacrifice as its main principles and as its core values in serving and protecting the public. Today, PRO7 is one of the model regions nationwide because of the gallantry and heroism demonstrated by our frontliners, by sacrificing efforts and ultimately risking lives to ensure public safety amid this health emergency crisis. It will continue further to work and implement its strategies against the spread of the virus through the I-5 strategy that will reinforce the national COVID response in Central Visayas. The mindset in this medical health emergency is that everybody has the responsibility. It should not only be the police, military, and health workers who will be responsible. It should be the fight of every Filipino.